Have you ever wondered what happens if you take Viagra for years? Does it keep working like magic, or could it come with hidden risks? While many men rely on the little blue pill for confidence in the bedroom, few stop to think about its long-term effects. Could it affect your heart, vision, or even fertility? In this video, we're diving deep into the science behind Viagra's long-term use, what you need to know before making it a regular part of your life. Erectile dysfunction, ED, is a sensitive topic for many men, but it's far more common than people realize, and fortunately, effective treatments are available. At its core, ED is a blood flow problem. When aroused, blood rushes into the penis to create an erection. However, if there's an issue with circulation, often due to conditions like high blood pressure, diabetes, or vascular damage, it can make achieving or maintaining an erection difficult. This is why ED is more than just a sexual health issue. It can serve as an early warning sign of underlying cardiovascular problems. Studies show that ED affects over a third of men under 40 and more than 70% of men over 70, making it a widespread concern. Medications like Viagra work by relaxing blood vessels and improving blood flow to the penis, making it easier to achieve an erection. However, while Viagra is highly effective in treating the symptoms of ED, it does not cure the condition. Long-term use requires careful management, as it does not address the root causes of ED, such as poor circulation, hormonal imbalances, or lifestyle factors. For the best results, men should combine medication with a proactive approach, adopting a heart-healthy diet, exercising regularly, managing stress, and addressing any underlying medical conditions. By taking a comprehensive approach, Viagra can remain a helpful tool rather than a long-term crutch. Can you take ED medications like Viagra for a long time? Yes, it is generally safe to take Viagra for an extended period. While there are no long-term studies spanning several decades, Viagra has been in use since its FDA approval in 1998, meaning some men have relied on it for over 25 years. By the end of 2005, more than 27 million men worldwide had used Viagra, including approximately 17 million in the US. As the first medication specifically designed to treat erectile dysfunction, Viagra has an extensive and well-documented safety record. Like any medication, it carries potential risks, but when used appropriately under medical guidance, its safety profile remains strong. However, it's essential to remember that ED medications like Viagra treat the symptoms rather than the underlying causes. Addressing contributing factors such as heart health, hormonal imbalances, and lifestyle choices is crucial. For many men, Viagra, at the right dose and frequency, becomes a long-term part of their healthcare plan, but it should be used alongside efforts to improve overall well-being. Data on the long-term use of Viagra suggests that for most men, the medication remains effective and well-tolerated over time. A 2007 study following men with ED for 4 years found that those who initially responded well to Viagra and experienced minimal side effects generally continued to do so. The study also indicated that adverse effects leading to dosage changes or discontinuation were relatively rare, with no significant increase in side effects or loss of effectiveness over time. However, some concerns have emerged regarding long-term side effects, particularly related to sensory, cardiovascular, and gastrointestinal health. In terms of sensory effects, reports have linked Viagra to potential hearing loss, prompting the FDA to add this warning to its label. Additionally, prolonged use may increase the risk of double vision, temporary vision loss, retinal hemorrhaging, and other vascular issues affecting the eyes. Cardiovascular risks associated with long-term Viagra use include an increased likelihood of stroke, heart attack, and vascular conditions such as cerebrovascular hemorrhage and transient ischemic attacks, TIAs. Some studies have also reported cases of heart arrhythmia, palpitations, and cardiomyopathy. Gastrointestinal and urinary side effects may also become more frequent with extended use. These include indigestion, diarrhea, gastritis, and a higher risk of urinary tract infections or incontinence. Some men have reported issues with ejaculation, including anorgasmia, though this side effect appears to be relatively rare, affecting less than 2% of clinical trial participants. While Viagra remains a generally safe and effective treatment for ED, long-term users should be aware of these potential risks and regularly consult their healthcare providers to monitor any emerging side effects. Psychological effects can also be a concern for long-term Viagra users. While the medication does not create a physical addiction, some men may develop a psychological dependency. This is particularly true for those who do not have erectile dysfunction but take the drug recreationally. An article published on biopsychiatry.com in 2004 cited reports of men using Viagra for performance enhancement rather than medical necessity, putting them at risk of relying on the medication for confidence rather than addressing underlying psychological or emotional concerns related to sexual performance. However, one reassuring finding is that Viagra does not appear to cause tolerance, meaning that men do not generally need increasing doses over time to maintain the same effects. A study conducted by Dr. Michael Zalewski and his colleagues followed 360 men who used Viagra after prostate cancer treatment-related erectile dysfunction. The study tracked these men for 4 years and found that 96% of them reported the drug remained as effective as when they first started taking it. This suggests that, when used correctly and under medical supervision, Viagra continues to work reliably without requiring dosage escalation, unlike medications such as painkillers or sleeping pills that can lead to tolerance over time. So, is Viagra a lifelong solution or a ticking time bomb? While it's generally safe for most men, long-term use does come with potential risks, ones you don't want to ignore. Always consult your doctor and consider lifestyle changes alongside medication for the best results. If you found this video helpful, don't forget to like, subscribe, and hit that bell icon for more expert insights on men's health, only on HeInfo.